The orbit has multiple potential spaces. Firstly is the subperiosteal space, which is located in between the bony wall of the orbit and the periosteum. Then comes the intraconal and the extraconal space, which is separated by the four recti muscles. Lastly, there is a potential space in between the Tenon's capsule and the sclera, that is known as subtenon space. The importance of these spaces is that these are potential spaces in which fluid from various pathologies can easily accumulate and thereby causing orbital symptoms. Moving to post-traumatic subperiosteal hematomas, as the name suggests, they are collection of blood in the subperiosteal space. They usually happen after trauma. So here is a case: an 11-year-old child with sudden onset apoptosis. On ultrasound, we found that there is a collection of fluid in the subperiosteal space. On CT scan, it is quite evident that there is a collection in the subperiosteal space in the superior orbit. So we planned for a drainage. We insert a 23 gauge needle into the subperiosteal space in the superior orbit and aspirated the hematoma. We were able to aspirate roughly 15 milliliters of blood, and immediately after the aspiration there was reduction in the apoptosis. Here are the pre and post drainage photographs. Post-traumatic orbital emphysemas occur after a fracture communicating the sinuses into the orbit. An example: a 50-year-old male presented with sudden onset eyelid swellings following an episode of sneeze. On examination, we noted that there was upper and lower eyelid swelling with palpable crepes. X-ray revealed a fracture along with air in the right orbit. NCCT also revealed the same, with the fracture of the frontal sinus along with air in the right orbit. Based on the findings, a diagnosis of right eye orbital emphysema was made and plan was emphysema drainage. We introduced a 23 gauge needle and some water in the syringe, and we saw, as like in the video, evident escape of air as bubbles. Immediately there was decrease in the eyelid swellings and the patient was relieved of symptoms. Orbital chocolate cysts usually arises from orbital venolymphatic malformations, typically noted in children. They are usually transcompartmental. Here is a case: a 10-year-old female presented with sudden onset swelling in the lower eyelid of the left eye. MRI revealed multiple fluid levels and says transcompartmental lesion. A drainage was planned and 23 gauge cannula was inserted, and after taking out the blood of the chocolate cyst, bleomycin was injected inside the same cavity. So here is 4 weeks follow-up showing almost complete resolution of symptoms. Orbital abscesses are basically infections of the orbit with collection of pus in the orbital spaces, most commonly in the subperiosteal space. Here is a 10-year-old child with left eye orbital cellulitis with limitation of extraocular movements and severe proptosis. The CT scan reveals that there is a collection of pus in the superior orbit. An opening was made using a needle and pus was drained using suction. After 1 week, extraocular movements had come back
Each of these techniques emphasizes anatomical awareness, surgical precision, and patient safety, which are the cornerstones of modern day orbital interventions. Thank you.